Hi, welcome to your daily dose at bloodtest.co.uk. A common conversation we find with our patients is discussing alcohol consumption, especially when they've been to a good party or celebration the day before. Sure, many of us enjoy the odd alcoholic beverage. However, drinking too much alcohol, especially on a regular basis, isn't that good, sadly, for our health or well-being. Drinking more than what is recommended can increase your risk of liver disease and many cancers. Therefore, it is best to keep within the weekly guidelines recommended by the professionals in healthcare in order to maintain optimal health and well-being. Generally, it's recommended that adults should not consume or drink more than 14 units of alcohol a week. And it's important to remember that the 14 units doesn't matter if you're a man or a woman, it affects both. So 14 units, either gender, is what is recommended. And these 14 units should idealistically be spread out over several days. So, for example, having it where you've got 2 or 3 alcohol-free days each week, and that's just going to give your body a rest and time to recover. One of the questions is, and it is quite confusing, how much is a unit? Because it varies on the drink, but a typical example is that a single unit of alcohol is equal to 10 mils or 8 grams of pure alcohol. Now, this amount can be found in a small, say 125 ml glass of wine, red or white, which has a 12% ABV. ABV standing for being alcohol by volume. So a single measure of spirits is 40% ABV, or a half a pint of beer, lager, cider, 4% ABV. It's important to remember that the strength and the size of the drinks can vary greatly, especially when you buy them from different places. So it's best to check labels carefully before you do drink it and just have a quick tally up of how many units are in that drink. If you do find you're consuming alcohol regularly or in excess amounts, it is recommended that you can get a liver health blood test, which used to be known as the LFT's liver function test. It's recommended you get a liver health test every 2 years or less by having, and this blood test is just purely a simple blood test, and that will check and keep an eye on what's happening with your liver health.